back to the pandemic now. I want to catch up with Dugald Saunders, who's the Nationals MP for Dubbo. He joins us from Dubbo. Thanks for joining us, Dugald. Difficult situation for your community, relatively speaking, low numbers of infections, but you know, you're a long way from the melting pot of Sydney, and you also have concerns about a large Indigenous population who are quite vulnerable to the disease. Give us the latest situation and your assessment of it.
Yeah, thanks, Chris. Good to join you this afternoon. Look, it is a situation that is ever changing. Unfortunately, the expectation is over the next few days we will see more and more cases. So at the moment in Dubbo, 91 confirmed cases of COVID-19 across the region, 98. There are significant, concerns around a more vulnerable community, and that certainly involves the Aboriginal community. And much of the transmission has definitely been through the Aboriginal community and literally face-to-face people in the same households. There have been quite a few school transmission sites as well. And so at the moment, what we're doing is really encouraging everyone as much as possible to do what we've been saying since day one, and that is stay at home. Don't move around between homes. Don't move family to family. You can't go and kick the footy with your mates. You can't go and see all your friends and family for dinner. You need to stay where you are. Meantime, we have amazing health teams on the ground working within not just our Indigenous communities, but also right through the community. We've got amazing testing facilities, which are unfortunately being overrun. There are a lot of people lining up for testing, which is great. We did about 5,000 tests overnight again in Dubbo. It'll be about the same today. Over 25,000 tests now. That will mean in the last 5 or 6 days. So we're doing everything we can. What we do need people to do is the right thing, and we'll get through this.
Now, the people who are getting worst affected by this outbreak are people who are in vulnerable categories and have not been vaccinated. Now, they should be vaccinated. Anybody who's elderly in this country, anybody over 60 really, has had ample time to get vaccinated. Some will be avoiding it by choice. Others might have slipped through, I don't know, complacency. Maybe others didn't organise it for them. What's gone on with Aboriginal communities? Because they are known to be vulnerable too, and they should have had very high levels of vaccination by now. Who's let the side down there?
Look, I think across the whole region, from Dubbo to the west, there has been availability of vaccines for a certain point. Many people have been reticent. Many people have done the pretty typical Australian thing and said, oh, she'll be right, I'll wait and see what happens. Now, of course, the pressure's on. Everybody wants to get a vaccine now because we know that there are cases and there are cases building. So, look, there has been opportunity. There have been clinics that have been across our western region that probably haven't been taken up very well by people across the west and in Dubbo. I mean, there's been vaccinations available in Dubbo for a year. I mean, there literally has been availability, and I know people that have had double vaccines for many, many months now because there was no rush on it. Now there is, things get difficult. But look, the good news is we've had fantastic support through the New South Wales local health district here. The Western CEO, Scott McLaughlin, and his team have been working well with the federal government. We've got an extra 7,500 Pfizer that have already gone to the Western region, and more thousands expected in the next few days to a week, so that we can keep getting those vaccines progressing. In the meantime, we've got plenty of pharmacies that have the Oxford University vaccine, AZ. That's the one I've had. That's the one I'm encouraging everyone who doesn't specifically need a Pfizer to line up for. And our community pharmacies do a fantastic job. People are used to getting a flu jab with them. I'm telling everyone, if you have your pharmacy that you know and trust, go and see them. Book in for an AZ, get it done as soon as you can, and that'll absolutely help.
Thanks for joining us, Dugald. I appreciate it.
Good on you, Chris. Nice to talk to you.
Dugald Saunders, the Nationals MP for Dubbo, as the virus spreads out to those regions. Now, if you haven't done it yet, we do this all the time. Go talk to your doctor. But you know the people who are most vulnerable are the over 70s. You can get a vaccine anytime you want if you're over 70. If you know people who have been reluctant, help them out. Drive them to the pharmacy or whatever and help them out. People who are overweight, who have diabetes, who have other conditions, also extra vulnerable. Talk to them. Make sure they get the vaccine because they're the people who are now ending up in ICU.